Welcome to Module 2. This module will focus on the scope of practice for service navigators. In Module 1, we learned about some of the causes of health disparities, which are differences in health outcomes in which one group has poorer outcomes than another group. One important cause of health disparities we discussed was barriers to healthcare access, or factors that prevent individuals and families from obtaining quality healthcare that they need. We talked about financial barriers to healthcare access, which include lack of insurance coverage and high cost of care, as well as non-financial barriers, such as cultural and linguistic barriers to communication with providers. In this module, we will be talking about how some of these barriers can be overcome with the help of navigators. By the end of this module, you should be able to explain the purpose of service navigation, describe what service navigators are and what they do, and understand how service navigation relates to your own work. So first, what is the purpose of service navigation? Well, as we discussed in the previous module, barriers to healthcare access often arise because healthcare systems and social service systems can be so challenging to navigate, making it harder for families and individuals to get the service and care they need. This is especially true when families are faced with other challenges, like housing instability, lack of transportation, poverty in general, or having a child with a disability or chronic health needs that require additional services or care. Service Navigators' job is to help families overcome barriers and access the services and care that they need. They employ a diverse range of approaches in their work. Service navigation can look very different from one navigator to another. Service navigators work in all kinds of settings, from mental and physical healthcare settings like hospitals or clinics, to government departments and agencies such as public health and safety or human services, to nonprofit organizations focused on health promotion or helping those in need, to the education system and schools. Service navigators also work with a variety of different populations. Many service navigators focus on working with families who have young children, and some focus on working with people ages 65 and older, and some service navigators work with clients of all ages. The reason we started off this training by talking about barriers to healthcare access is that the primary role of service navigators is to help individuals and families overcome barriers to accessing healthcare and other services that they need. However, although navigators connect families to resources in their community and help them problem solve to overcome barriers, there are still many barriers and challenges that navigators face when attempting to help individuals or families. We will discuss these challenges more in the third and final module when we report the findings of our study. For now, let's look at the domains in which service navigators practice. As mentioned, service navigators work in a multitude of different settings with different populations and use a diverse array of approaches to help their clients. So service navigation as a field can be hard to define. However, the following list of domains of service navigation practice were drawn from existing literature and service navigation and community health worker practice documents. And these were also all endorsed by service navigators as all being highly important to their work. First, engaging and retaining clients. So identifying eligible individuals or families, keeping them connected to the navigation program over the course of service delivery. Establishing and maintaining a working relationship with clients, so building trust, rapport, mutual respect, and understanding. Assessing clients' specific service needs and barriers, so identifying clients' challenges or difficulties they experience when attempting to access services. Engaging in collaborative service planning with clients, so clarifying goals, creating a mutually agreeable plan to access needed services. Anti-oppressive practice, recognizing the effects of oppression, identifying structural issues that impact clients' access to care, and equalizing power imbalances in working relationships. Identifying services that are personalized to the client's specific situation, finding a provider who speaks their first language, for example, and promoting self determination and empowerment, encouraging client decision making based on their own values, goals, and priorities. Conveying empathy and compassion and providing support. So, reflecting clients' frustrations or challenges and providing emotional support. Providing resources and education. So, sharing information about specific services or programs, educating clients about their eligibility and rights to access certain services. Cross cultural practice. Working effectively with clients whose culture is different from your own. Staying focused during the navigation process, so centering client service needs at each contact and assisting them with achieving their service access goals. Problem solving challenges in the navigation process, so working with a client to resolve a persistent service barrier such as wait lists or transportation issues. Building and maintaining client motivation, so identifying where someone is in the stages of change, working with and resolving client ambivalence or lack of follow through. And conducting strengths based, solution focused interviews. So, asking questions that focus on identifying and using client strengths to overcome challenges. Engaging in advocacy and outreach to providers and the community. So, contacting service providers and other stakeholders to advocate for service access on behalf of clients. Resolving individual, family, or community level barriers to care. So, helping a client find transportation, building family member buy in to get help. Monitoring client progress and collecting actionable data. So, using assessment and evaluation tools, using data to inform decision making. Consultation, training, and supervision. So, providing or receiving guidance, support, or education related to your service navigation. And finally, navigator well being, mental health, and burnout prevention. So, self care strategies or setting appropriate boundaries with clients. All right, now for some discussion. As in the last module, you can pause after each question and discuss if you're in a group or journal if you're just watching by yourself. First, think over the domains of practice that we just went over. There were 19 of them. Probably at least some of these relate to your work in child welfare. Would you describe any aspect of your work as service navigation? Do you work with any service navigators? How is navigation helpful in your work? Or how could it be helpful? What are some barriers that might make it difficult for service navigators to assist people in accessing healthcare? Here are the references for this module. Thank you for listening, and we'll see you in Module 3.